honorable ministers present, principal secretaries present, colleagues, all protocol observed, good afternoon. Good afternoon. I know it's afternoon. I know you have taken heavy lunch, and that's why I had to change my presentation. I had remarks to make, but I've realized remarks everybody's reading, and no one is listening. So I just want to do a presentation about the same remarks in the format of presentation. I'm Dr. Mohamed, Sheikh. I'm the Director General for the National Council for Population and Development. This is an institution that's mandated on issues of population in Kenya. I don't know whether it's coincident, but one thing you need to remember or know is that Ghana and Kenya were the first free African countries to establish family planning in 1967. So please clap for us. So ladies and gentlemen, this is just a presentation. For those who don't know Kenya, Kenya is a country located in sub-Saharan Africa and Africa, in particular in East Africa, with a population of currently around 56 million. We are the fourth largest economy in sub-Saharan Africa, with a GDP of $89 billion US, with population size you can see there. This is some of the membership of this East African, some of this African membership. We're in East African community, we're in the African Continental Free Trade area, we're also in the African Growth and Opportunity Act, but without populations. Next, please. Look at the Kenya population. In terms of population, Kenya population dynamic is changing from a childhood-based population to more of a youthful population. You can just see the blue color. That is the age between 0 to 14 years. It is coming down, and the age to 15 to 60 years is increasing. That is around 75% of Kenya population is below the age of 35 years, compared to Zimbabwe, which I think the president in the morning mentioned, over 60% of, I think, of Zimbabwe, also below the age of 60, the age of 35 years, This is the Kenya population pyramids. You can see comparing. We conducted census. We do consensus after every 10 years. This was census conducted in 2009 compared to the one that was done in 2019. In 2009, you could see there the pyramid down there. The base is protruding, but slowly the middle is getting a bit, it's increasing. That age group of 14 to 60 or 10 to 14 is increasing. 20 to 24 is increasing. So that age group is increasing. So I'm sure this one, there is some, you need to understand about the demographic dynamics at that age group. If you look at some of the trends and the statistics, if you look at infant mortality, just comparing 2003 to the last 2030, we conduct Kenya Demographic Health Survey, the Demographic Health Survey after every 5 years. So the last one was done in 2022, sorry. So compare that one of 2003 to 2023. So 2003, you see there, our infant mortality rate was 77. Currently, it is 32 per 1,000 live births. If you look at under 5 mortality, it was 115 per 1,000 live births. Now we are talking about 41, the red color. And then look at the maternal mortality, the pink color there. The maternal mortality was 570 per 100,000 deliveries. But right now it is around 355. I think Zimbabwe in the morning, as you said, it was 365, yeah? So it's just the same range with Zimbabwe, but that's where we are for maternal mortality and child mortality. Looking at the trends of total fertility rate, our total fertility rate has declined. It is 3.4 at currently from our figures of 4.9. If you look at contraceptive use, the CPR, it was 39, but right now we are talking about 57, CPR of 57%. Our target is to reach by 2030, 65%. If we look at unmet need for family planning, it has declined to 14% from as high as 27% in 2003. So looking at these trends, at least Kenya is making progress in terms of child mortality reduction, maternal mortality reduction, infant mortality, family planning, CPR, and unmet need for family planning. This is, again, the elephant in the room for Kenya, the teenage pregnancy. It is an average of 15%, but that's not the concern. Our concern is the county differentials. Kenya is a region. We have what we call counties. We used to have provinces, but right now we have 47 counties. So there are some counties with a teenage pregnancy of 50%. That means girls aged below the age of 19 years they're either pregnant or they already have children. And that's really something that's really, as a country, we have formed what we call a multi-sectoral coordination team to look at issues of ending teenage pregnancy. Our target is to end teenage pregnancy. So we have formed what we call a campaign called Ending the Triple Threat. Triple threat is ending HIV, ending gender-based violence, and ending teenage pregnancy, because that combination is what's really having an impact on our youth. This is the commitment we made in Nairobi as a country in 2019, the conference that was held in Nairobi. We made 17 commitments. In line with this is that we should provide essential RH package of interventions and UAC, including SRH. Commitment number 6 was accessing quality data. And then the other commitment, 6 to 7, is more of investing in DD, the demographic dividend, and the drivers of the DD. And then from 13 to 15 is eliminating gender-based violence and harmful cultural practices. Commitment 16 is in spirit of leaving no one behind, commit provision of reproductive health services and information in humanitarian and fragile contexts. And lastly, his commitment is to ensure Kenya accelerates the promise of ICPD program of action. The country commits to track and monitor the implementation of the ICPD Nairobi commitments. In terms of achievements, is that first after the conference, Kenya, we formed what we call a coordination framework of the National Task Force. A National Task Force was formed, and then we developed the National Action Plan that is 2020 to 2030. So we are using that action plan to monitor and implement the ICPD commitment. Up to now, we have developed 4 progress reports. The annual ICPD progress report is prepared annually and is launched from the highest office of the government. And then we also use national reporting mechanism, especially we have a national INEMIS that is integrated electronic reporting, where all ministries report to one portal on the 17 commitments. And lastly, we're using technology to disseminate the ICPD report every year. On the other fronts is that Kenya is also focused on providing universal health coverage to all citizens. And in this regard, we implemented UHC, especially focusing on primary health care. We did in 4 counties, and right now there's a rollout to across the 47 counties. And the focus is primary health care, using the level 1, level 2, level 3 in terms of healthcare service delivery. And then more than this, the number of healthcare workers trained, and then also we are changing the healthcare insurance system in this country, especially focusing on those who are needy and those who are poor population. The next, please, is that this is, in terms of allocation, a commitment we made in line with the Abuja Declaration, 15%, although we have not reached there. At least gradually we're increasing funding for healthcare services. So you can just see that from 2015, 2016, this is the budget allocation for the Ministry of Health, and then gradually we have increased these figures from as low as 117 billion, that's Kenya shillings, to 160 billion for healthcare services. And these are some of the achievements, and what I talked about is the triple threat. This is a campaign, I think, where we have combined efforts. What we realize is that the coordination of ending teenage pregnancy was not multi-sectoral. It was not well coordinated. So we formed a national steering committee chaired at the national level. And that is, we're using, in Kenya, we have a system called the administration. Those are people who work with the community. And we're using that system. We brought all the government agencies and coordinating this triple threat. And this is just the first picture you can see at the national administration. These are very powerful people in Kenya. I'm sure they exist also in Zimbabwe and many other African countries because the structure is more of a British system. Looking at the other one is about the integration of adolescent issues in school and training curriculum. That's another program also we're having. And also involvement of religious leaders in terms of ending teenage pregnancy. The religious leaders sign a commitment to help and assist the government in ending teenage pregnancy, using the pulpit to educate the public on issues of teenage pregnancy. Here is some other achievement. We have, in line with the ICPD, we have revised our population policy. The policy already has been approved by our cabinet and already is with the parliament, so for approval. In this week, it's going to be approved. And then also we're doing on harnessing the demographic dividend, integrating the demographic dividend data at the county level and at the regional level. and then also enhancing availability of the use of data. The Kenya census was one, I think, of where technology was used to conduct, I think, a thorough census survey across the country. Lastly is integration of population health in focusing on issues of climate change. We're also strengthening the PHE model of healthcare services across the country. Ladies and gentlemen, I think that is just some of the success stories from our country, is that our country was awarded just on 18th February 2023, Kenya was honored at the AU Summit for innovative and collaborative approach to improving reproductive, maternal, newborn, and adolescent health. That's the RAMCA scorecard. So Kenya, there's a RAMCA scorecard, which was initiated or was supported by the African Malaria Alliance. And Kenya was the first country to adopt, and Kenya was rewarded or awarded for that innovation. The other one was Kenya was ranked 3rd in Africa in the Global Health Security Index of 2021 on the road to realizing the universal health coverage. And that is another program on the exchange learning program we had with our brothers from Indonesia. We visited here from Professor Thematic, and we visited a town called Madiun, a very beautiful city, on learning how Indonesia has managed issue of population programming, and we have learned a lot from them. Thank you very much, ladies and gentlemen. God bless you.